So hi everyone. Thank you so much for joining our seminar today. Today we have Dr. Barry Rawicki, and he is a physician specializing in rehabilitation medicine and pain medicine. His expertise lies in the assessing the long-term effects of injuries, disease, and medical management issues. He has a particular focus on neurology, including spinal cord injury, stroke, acquired brain injury, and pain management, including interventional procedures. He's also skilled in estimating life expectancy. So over to you, Dr. Rawicki.
Thanks very much, Sophia. And thanks for offering me the opportunity to discuss and present regarding my CV, especially with respect to writing medico-legal reports. As Sophia said, I'm a physician in rehabilitation medicine. I obtained my specialist qualifications in 1985, which is a couple of years ago. In those days, rehabilitation was a very young specialty, and even as a very junior consultant, as soon as you obtained your specialist qualifications, it was only a matter of what you wanted to be ahead of. So after working for a short period at the Royal Talbot Rehabilitation Hospital in Kew, I went to Canada and spent 18 months in Vancouver, working under a number of more senior rehabilitation physicians, and fortunately not as the head of department, so I had lots of opportunity to learn. After returning to Australia in 1986, I worked at Caulfield Rehabilitation Hospital, and there I was the director of the spinal rehabilitation unit from 1988 until 1995, and was also director of the neurology rehabilitation unit at Caulfield from 1991 until 1995. In 1995, I left Caulfield and became head of rehabilitation for what was then Southern Health, which is now Monash Health, from 1996 until 2005. So I was initially at the gloriously located Hampton Rehabilitation Hospital on Beach Road, where we had wonderful views and the beach just across the road. The land, of course, was then sold for private development, and rehabilitation moved to the Kingston Centre. In addition to my work at Monash Health, I was also medical director at St John of God, Nepean Rehabilitation for a couple of years, from 2005 until 2007. I was the medical director and senior physician at the Clinical Gate Assessment Service, which is located at Monash Health, for 21 years, from 1999 until 2020, and have therefore very extensive experience in gait assessment and gait management. I was also the inaugural president of the Victorian Brain Injury Recovery Association. I've held numerous positions for my professional body, the Australasian Faculty of Rehabilitation Medicine of the Royal Australian College of Physicians, including heading up registrar training and being chairman of the board of continuing education of the AFRM of the RACP. About 17 years ago, I established the paediatric rehabilitation service at Monash Children's Hospital. Not by myself, obviously, but I was the initial medical director and remain the medical director of paediatric rehabilitation for the Victorian Paediatric Rehabilitation Service at Monash Health and Monash Children's Hospital. I'm actually leaving that position in 2 weeks today, after establishing that service, and looking at continuing my other work once I leave here. In the private sector, I was head of the rehabilitation of what ultimately became Epworth Rehabilitation Brighton.
Please, Medical Pediatric, Monash Children's Hospital, Stepping Stones ICA, Medical Pediatric, Monash Children's Hospital, Stepping Stones ICA.
So in the private sector, I was head of rehabilitation for what ultimately became Epworth Rehabilitation Brighton. It had a number of different iterations from when I first established that, what was initially a private nursing home, acute medical hospital, into a rehabilitation service. And I stayed head of rehab at Epworth Rehabilitation Brighton, which took over in about 2010, from 1991 until 2020. I have been in private clinical practice for about 30 years. I founded and am the senior position at the Central Rehabilitation Group. We now have 5 rehabilitation physicians working in that particular service. That's one of the very few private rehabilitation practices, not only in Victoria, but in Australia. I was appointed Associate Professor in the Department of Medicine at Monash University in 1999, and then in the Department of Paediatrics at Monash University. I was appointed Consultant Emeritus at Epworth Hospital in December 2020, which was when I left Epworth. And I was awarded the Medal of the Order of Australia for services to rehabilitation medicine in June 2021. I've done a reasonable amount of research, not as much as I would have liked. I've published about 35 or 40 papers and 2 book chapters in a variety of rehabilitation and pain areas. I have attended and continue to attend meetings and conferences in Australia and around the world, mostly to present papers in general rehabilitation and also pain medicine. With respect to medico-legal work, I currently write a significant number of reports. I have expertise in both clinical and in medico-legal work in both adults and paediatrics due to my experience in both adults and paediatrics. I have particular expertise, as Sophia mentioned, in chronic neurology, including stroke, brain injury, spinal cord injury, and cerebral palsy, in spasticity and spasticity management, chronic pain management, including interventional pain management, as well as other aspects of chronic disability, including rehabilitation. I also have specific expertise in scientifically evaluating life expectancy, including using regression analysis where there are multiple comorbidities. And that's obviously a very important aspect of medico-legal work, where getting a good idea of how long somebody's going to live has a significant impact on what settlements are going to be. I've also written a number of reports on the costs of end-of-life care. I think that probably covers all the things that I wanted to say about myself and about the sort of work that I do. I'm certainly happy to discuss any of these points if people wish to do so. Thanks.
Yeah, thank you so much, Dr. Rawicki. If anyone has any questions, just come forward, unmute yourself, and yeah. Yep. So it seems like there's no question. However, this will be uploaded on our YouTube channel. So if anyone has any questions, they will probably send it through to us, and we'll send it through to you, Dr. Rawicki. But thank you so much for today and for hosting.
No problem. Okay.
Thank you.
Thank
I'll
you.
stop the recording.